And I want to thank the governor. I want to thank Representative Canty, Senator Villanueva, Director Vora, and all of my colleagues here for convening to talk about the Dobbs anniversary and this incredible bill today. 4 years after Dobbs, I wish we weren't here having this conversation. I wish people were not still being forced to leave their home states for health care. I wish thousands of people each year did not have to navigate a maze of bans, restrictions, and financial barriers to access common, essential, life-affirming, and often life-saving health care. I wish our providers were not operating under constant political attacks. But that is the reality we are living in. 4 years after Dobbs, I am constantly reminded, though, that our communities are far more resilient than the politicians trying to control them. Earlier today, we sat down with providers, advocates, and healthcare leaders from across Illinois to reflect on what we've built together since Roe was overturned. I'm so grateful to Governor Pritzker and the leaders here for joining that conversation and for hearing directly from the people who have spent the last 4 years helping to turn Illinois into a place where abortion access is not just protected, but possible. We knew 4 years ago when the Dobbs decision came down that the landscape of abortion access would drastically change overnight. And the way the Illinois abortion access ecosystem and the Chicago Abortion Fund have grown and met this moment certainly reflects that shift. In the 4 years since, CAF has supported more than 60,000 people seeking abortion care and provided over $25 million in direct financial and logistical assistance. What was once a regional support network has become a critical piece of the nation's abortion access infrastructure, helping thousands navigate bans, restrictions, and financial barriers to obtain the care they want, need, and deserve, no matter who they are, where they are from, or how much money they have. Today, 1 in 4 people who travel out of state for an abortion come to Illinois, and CAF supports nearly half. That did not happen by accident. It happened because providers, advocates, and elected leaders made a conscious decision that Illinois would be a place where people could be supported with dignity and compassion. While other states were passing bans and restrictions, Illinois invested in access. Governor Pritzker and leaders in the General Assembly understood early on that protecting abortion rights on paper would never be enough. They understood that the protections we have in Illinois should not only be available to people with the means to get to them. The legislation being signed today is the latest example of that commitment. From strengthening SHIELD laws to implementing HB 40 to expanding access on college campuses, the governor and his administration have repeatedly shown that when abortion access is under attack, Illinois will not stand still. 4 years after Dobbs, I will not pretend that this story has a happy ending. Every day, people are still forced to leave their homes, their families, and their community to access health care. Every day, abortion bans continue to do real harm. But I also know this: they have not stopped abortion, they have not stopped patients from seeking care, and they have not stopped all of us. So while I look back on 4 years of post-Roe America with heartbreak, I look ahead with determination. We know how to help people get care, and we know that when providers, advocates, patients, and elected leaders work together, we can accomplish extraordinary things that change lives every day. This work will continue because the need will continue, and so will all of us. Thank you, and I'd like to welcome Governor Pritzker.
Thank you very much, Megan, and welcome and good morning, everyone. I want to thank everyone for being here to mark the anniversary, the 4th anniversary, of course, from the Dobbs decision. And in doing so, we are taking an important step forward in protecting reproductive freedom in Illinois. 4 years ago, the right wing on the Supreme Court overturned Roe v. Wade, eliminating a right that women in this country have relied upon for nearly half a century. The consequences of that decision have been devastating. Since Dobbs, states across this nation have enacted draconian abortion bans, restricted access to life-saving health care, and empowered politicians to interfere in the personal medical decisions of women. Patients have been denied treatment. Providers have been threatened with prosecution. Women have been forced to travel hours to receive medical care. Over those 4 years, we've witnessed real legislated misogyny. But we've also seen remarkable courage. We've seen women come forward to tell their stories. We've seen advocates refuse to back down, and we've seen healthcare professionals continue showing up for their patients despite unprecedented threats. We've seen people across the country march and protest and stand up to say that reproductive freedom is worth fighting for. The state of Illinois has pushed back on the anti-woman, anti-choice policies imposed by the Supreme Court and the Trump administration. Today, we're taking another step forward in our pursuit of freedom. I want to take a moment just to recognize and thank some of the partners here who have made Illinois a safe haven for women seeking to control their own health care without government interference. Megan Jaifo, who you just heard from, and her incredible team at the Chicago Abortion Fund. The advocates for women's rights who have stood guard in the face of relentless headwinds from the right-wing extremists. All of the incredible providers here and across this state who are showing up for patients every single day with courage and compassion. Outspoken champions in the General Assembly like Senator Selena Villanueva and Representative Mary Beth Canty. Dr. Samir Vora, our terrific head of the Illinois Department of Public Health, and of course my team in the governor's office, most especially my senior advisor, Emily Miller. Today is yet more progress in rejecting the invasion on privacy rights being perpetrated by states across the country. I'm proud to be signing today the Reproductive Health Records Privacy Act, legislation that strengthens protections for patients' personal information by prohibiting sharing of abortion-related medical records with out-of-state healthcare providers, without explicit patient consent. A woman seeking care should not have to wonder whether her private health information could be used against her. A healthcare provider should not have to fear that patient records will become a tool for political prosecution and persecution. And no state should be allowed to weaponize medical information in an effort to undermine rights that are protected here. Healthcare records exist to treat patients, not surveil and punish them. I will always stand firmly on the side of privacy, dignity, and freedom, and this bill is yet another example of what has become a defining commitment of our state. While lawmakers elsewhere seek to roll back rights, Illinois will protect our people. The Illinois Department of Public Health is also expanding the type of reproductive health products that pharmacists can provide directly to Illinois residents through their local pharmacies. This action means that some products can now be covered by Medicaid and certain insurance plans, which will reduce costs for families. You'll hear more about this from Dr. Vora shortly. As a result of our work, Illinois will remain a national leader in protecting reproductive rights and safeguarding individual freedom. In this state, we have established reproductive health care as a fundamental right. We have established and strengthened our SHIELD laws to protect patients and providers from out-of-state investigations and prosecutions. We have expanded access to contraception and medication abortion. We have invested in reproductive health care and in the infrastructure that's necessary for it. We have partnered with providers and advocates to make sure that health care, and that's what this is, health care, is available to those who seek it. But our work is never finished because the opponents of reproductive freedom continue searching for new ways to restrict women's rights, intimidate providers, and insert government into personal medical decisions. Nothing triggers these retrograde right-wing politicians more than a woman's power to make her own decisions. But we're making sure that Illinois women never have to question whether their voices and their choices matter here. They do matter, and in Illinois they always will. The Trump administration intends to use every lever of government power available to restrict reproductive health care, whether it's attacks on medication abortion, efforts to undermine patient privacy, attempts to intimidate providers, or schemes to allow other states to punish people for seeking legal care here. Their goal is the same: to take away a woman's right to make her own healthcare decisions. Today in Illinois, with the signing of the Reproductive Health Records Privacy Act, we take another step to fortify our firewall of protection for women. As long as I'm governor, Illinois will continue standing on the side of reproductive freedom, bodily autonomy, and the simple belief that women, not politicians, should make their own healthcare decisions. With that, I'm very pleased to pass this podium over to an outstanding and outspoken champion of freedom and of reproductive rights, Senator Selena Villanueva.
Good morning, everyone.
Good morning.
I'm Selena Villanueva, and I proudly represent the 12th District on the southwest side of the city of Chicago. Before I go into my remarks, I really want to give some major thanks to our Senate staff who worked on this bill, but in particular to Governor Pritzker for being the champion that he is, and to his incredible team, including Emily Miller, Lindsay Volz, and Ali Mazada, who literally did so much incredible work in order to get this across the finish line. I wanted to give you guys your flowers. I am so proud to be from the state of Illinois. I am proud to be a born and raised Chicagoan. And I'm proud of this because the signing of House Bill 5295 into law today marks a turning point in our state's history. Not only for the women who call this state home, but also for every individual who has been forced to come to Illinois to seek critical health care, because that's what we're talking about when we talk about abortion care. On June 24th, 2022, the Dobbs decision ended the constitutional protections that we had enjoyed for decades, in turn causing reproductive health care access to become a variable from state to state. In Illinois, however, we value bodily autonomy and we like to ensure the fact that women have a voice. But some states have implemented restrictions on abortion and gender-affirming care that cause trauma and, in worst case, criminalization for a patient or their provider. Part of protecting our residents or any individual who comes to Illinois seeking care is recognizing when their health data is a risk or at risk. We know healthcare facilities and institutions capture, collect, and share data about pregnancy, abortion, gender-affirming care across hospital systems with the goal of coordinating patient care. We also know patients, healthcare providers, and facilities could be forced to battle legal disputes if a patient's reproductive health care ends up in the wrong hands. By implementing the Reproductive Health Records Privacy Act, we're taking direct steps to combat continued attacks on bodily autonomy and keep reproductive health data out of the wrong hands. This new law will send a clear message that in Illinois, abortion is health care. Gender-affirming care is health care, and it is for all of our residents. Their access to healthcare services and their healthcare records will be protected. The law will require health information exchanges to limit the transfer of abortion-related medical information across healthcare systems and ensure that the data is not shared across state lines unless a patient opts out of this specific data segregation. We've heard stories time and time again of women who are terrified of being criminalized after seeking pregnancy or abortion-related health care. We cannot and will not allow women to live in fear for exercising their legal rights to choose in Illinois. This is about making sure that women across the state don't live in fear for seeking critical health care, especially abortion care, or face persecution if their private health records fall into bad actors' hands. Additionally, it's about making sure that anybody that's coming to the state of Illinois' health data is also protected. I wanted to share this because we were having a conversation with the governor a little while ago when he brought up his mom. And the governor and I shared that we lost our mothers, and I think both of them made very big impacts in our lives. And I often get asked the question of why I'm such a staunch supporter of reproductive health care and reproductive rights and abortion care and gender-affirming care. And I talk about my mom because my mother was an immigrant herself. She came to this country about 50 years ago. A little girl, she was 13 years old. But when my mother came to this country, she came from a very long lineage of women who didn't have a right to choose. I come from a very, very large Mexican family. My mother was one of 10. My father is one of 9. I have a lot of first cousins. I got a lot of people. And, you know, our get-togethers are very loud and boisterous. But I'm literally the first in my line to be able to make a choice about my body. And when my mother would have arrived here in the 70s in this country, and Roe versus Wade was, you know, I think actually the decision had already been made. What you saw in the streets and in the neighborhoods in our communities wasn't always that practice because things were not set up. The system wasn't set up. So when my mother was a teenage mother, having to make decisions, very, very large decisions about deciding at 17 whether she was going to have my sister or not, it wasn't a choice that she could make. The choice was have my sister, then my older brother, then myself, and eventually my younger brother. But during that entire time that she raised us with the belief that we had a choice and that our work was to ensure that everyone else did. And that's what we do with laws like this. That's what we do when we enshrine protections to abortion care, to gender-affirming care in this state. We change the trajectory of lives, of lineages, of the future of so many people who are residents of the state of Illinois, but also who come to Illinois seeking something that should be legal throughout this country, but unfortunately isn't because it has been politicized. And so I'm happy that we're here today. I'm sad that we're living in the circumstances that we're in, but I'm so proud to be able to be from the state of Illinois and to have the leadership that we have to fight back against the status quo that continues to tell us what we have the right to do. Because in Illinois, we're fighters. In Illinois, we know that women are fighters, and we know and we believe that women have the right to choose. And with that, I want to thank everybody and bring up my fighter, my partner in this fight, Representative Mary Beth Canty.
Thank you. Good morning. I am Mary Beth Canty, and I want to make sure that you know at the outset that I am a mother by choice, and I am a mother for choice. And Illinois has long been a haven for people seeking vital health care, including abortion and gender-affirming care, and today we're making that haven more secure. It is one of my top priorities through this bill and others. When someone travels to Illinois to receive care that has been criminalized in their home state, they shouldn't have to wonder whether their medical records will follow them home and be used against them. Just today, on my way into this room, I heard a story of a woman who received abortion care here in Illinois, and her doctor in her home state found out that she had received this care and reported her to CPS. This woman, who is trying to make the right decisions for herself and her family, runs the risk of losing her children for getting lawful health care. So the fear that we are guarding against here is extremely real, and it's kept people from getting the care that they need. This act, this bill, the Reproductive Health Records Privacy Act, will change all of that. It will prohibit healthcare providers and insurers from disclosing a patient's abortion or gender-affirming care records to out-of-state providers, employers, or other third parties without explicit consent. And I can't tell you how important that is. When we're talking about people and the decisions that they make with their bodies, I am raising my children to seek enthusiastic yes instead of the absence of no. It applies in all behaviors that we all encounter, and it definitely is inhibited when we can share that information without our knowledge. Across the country, states are passing laws that treat essential health care as a crime. They're coming after patients, they're coming after doctors, and in Illinois, we're saying, not here. I believe in the power of the people. I believe in the power of patients. I want to thank my colleague, Senator Villanueva, for leading us in this fight and in others. And I want to specifically call out Allie, Lindsay, and Emily. All the hours that you put in, all the words that you held back so that we could do this in a collaborative way when we were hearing some of the most insane arguments for why we shouldn't do this. I deeply respect you and I applaud you. We're lucky to have you in the state of Illinois. And Governor Pritzker, this has always been a key initiative for you to protect women, to protect families in meaningful ways that they will know throughout their lives. It is not a partisan issue. It is not something that you do just for show. And across the state of Illinois, people feel that and they know it. So thank you for letting me be the House champion of this effort. And I am so grateful to all of the advocates in this work. And I look forward to working with you in the future. It is now my honor to bring up Dr. Vora.
Well, good morning, everybody. Good morning. I'm Dr. Samir Vora, Director of the Illinois Department of Public Health. Thanks to the leadership of Governor Pritzker, Senator Villanueva, Representative Canty, and their colleagues in the General Assembly, today Illinois is taking another important step towards protecting the reproductive rights of Illinois residents with the signing of the Reproductive Health Records Privacy Act. This act will provide Illinoisans and those who come to our state for care, privacy, and protection during one of their most vulnerable moments. At IDPH, the Illinois Department of Public Health, our work is focused on protecting Illinois residents today and preparing them for tomorrow. A critical part of this effort is understanding that reproductive health is public health and ensuring our residents have the tools to make informed decisions about their health. That is why today, under Governor Pritzker's leadership, I'm pleased to announce an updated contraceptive standing order, which expands access to reproductive health products for Illinois residents. This standing order will grow the ability, as Governor Pritzker mentioned, of trained pharmacists to provide prescription birth control methods and other reproductive health products directly to Illinois residents. Improving access to contraception at local pharmacies is an important part of removing barriers to care, allowing people to get reproductive health products in their communities without a separate doctor's visit. With this new order, pharmacists who have completed the required training can dispense most forms of prescription contraception, including emergency contraception and other non-hormonal contraception. This order also increases access to over-the-counter reproductive products by providing a prescription for pharmacists to offer over-the-counter emergency contraception, over-the-counter progesterone-only contraceptive pills, condoms, and pregnancy tests, allowing the items to be covered by Medicaid and state-regulated insurance plans. Now, this update builds on a series of steps that Governor Pritzker and IDPH have taken in partnership with our sister state agencies and community leaders to protect and improve reproductive health in Illinois, including our original 2023 order that gave pharmacists the ability to dispense certain prescription hormonal contraceptives to begin with. Now, we've heard a lot already that we're just very proud to be here in Illinois. And we're proud because we continue to work collaboratively to protect reproductive health care for our residents. This updated standing order is just another step in our journey to ensure that reproductive health care is protected here in Illinois, improving the public's health now and into the future. Thank you very much, and now for the governor to come to sign this very important bill.
Thank you, Dr. happy to take questions from members of the media. Oh, they're shy today. Oh, there you go. Sarah, you're not shy. Okay. You're just being polite. Got it.
4 years ago in the midterms, obviously abortion played a big role. What kind of role do you think it's going to play in these midterms, especially since it seems like affordability and inequality seem to be the big issues?
Well, you're not wrong that there are lots of issues that have come up, especially because we have a very different president who has put middle class and working class people under attack, and especially the most vulnerable. So I think we have a lot of things like health care, food assistance, the cost of living in general as major issues. But I can tell you that it matters a great deal to people in the state of Illinois and across the country about whether their reproductive rights are being protected. And there is, I know, at least in my race for governor, there's a choice to make between somebody who believes in standing up for women's reproductive rights and someone who wants to take those rights away. I think there are races around the country where that's the case, and I think that will matter to a whole lot of voters.
Is it the right strategy for Democrats in the midterms?
When you say strategy,
Well, to lay up abortion?
I think it will depend on race by race. I mean, these are the midterm elections. They're not national in nature. I can tell you that, like I said, there is a very strong voice of people across the state of Illinois that don't want to see their reproductive rights taken away. So in terms of playing it up, I mean, you've heard me talk about a whole lot of very important things to the people of the state, particularly trying to lower costs, trying to deal with the onslaught from the federal government of taking health care away. And this is another example of health care being taken away, another example of the federal government, the Supreme Court trying to take away the rights of women to receive the health care that they deserve. Sorry, how about Chris, and then I'll get back to you, Dan.
Governor, it's been a pretty historic year for tornadoes around the state of Illinois.
Yes, it has.
When we talked to you back in March in Aroma Park, we asked you the question of how confident are you that FEMA dollars will come to that town, and you told us at the time, you can see that this community needs help. This is not always the case. My confidence comes from politics shouldn't play a role. The question was, do you think your friction with the president might impede FEMA dollars? We're learning now that FEMA dollars will not be coming to Aroma Park. They were denied those dollars. Can you speak to that and what message you have to Illinoisans?
Yeah, just to clarify the record, SBA dollars, which are different than FEMA dollars, but also associated with disasters across the country, are coming to Aroma Park. Not FEMA dollars, though. You're right to point that out. The President of the United States has withheld FEMA dollars across the country, and yes, in Illinois as well. I think that sometimes he does it for political reasons. I think it also has been the policy of the administration to cut back on federal support when there is an emergency. We've seen that everywhere, and that's dangerous. I mean, think about the impact of so many floods and hurricanes and tornadoes that have affected this country and will continue to, and the president doesn't want the federal government involved. Because that's really what FEMA, it seems like it's heading toward, where it's just going to be uninvolved. They've raised the thresholds for getting support. They've made it harder for communities to get support. It's quite disappointing. And I continue to be an advocate for maintaining the FEMA funds that were available prior, because unfortunately, climate change in particular, there are lots of other kinds of disasters I won't want to point out, but climate change has now brought more disasters on a more frequent basis. May I address the point you're making about Illinois? We've had 149 tornadoes in just the first half of the year this year. That's more tornadoes than ever before recorded. And it's only halfway through the year. We had 142 in the whole year of 2024. So we are in the midst of an onslaught of the effects of climate change in all of these tornadoes that have hit. So I'm going to continue. I was just in Charleston. Our IEMA director literally was he's been to Charleston a number of times, but his whole team Jefferson County, Streeter, et cetera. I mean, we really, lots of places have been hit, some more than others. And so we're trying very much to get the resources there as fast as we can. I'm making sure that I'm visiting as fast as I can without disrupting local recovery efforts, because the most important thing here is the delivery of services, whatever we have available to us. And then, and that's the immediate emergency that has to be responded to over the few days after something like this happens, then comes the effort to get, well, remunerated by the federal government, which, as you're pointing out, has not been forthcoming in many cases.
So when you said to us in March you don't think politics will play a part, do you now think that politics did play a part in the thumbs down for Roma Park?
It's hard to tell. I will say, I mean, here's what I mean, it's hard to say that this administration doesn't have politics playing a part in virtually all of its decision-making, even when there are lives at risk. But, you know, I also will say, I mean, I looked at a study that showed that I think it's on a per capita basis, that California, Illinois, and Ohio have received the least remuneration in the face of disasters. And I think, again, it's on, I think, it might either be on a per disaster site or a per person basis. But I saw Ohio in there, and I thought, that's a Republican state. It's controlled by a Republican legislature. So I'm not sure, and maybe it's that the president does not like Governor DeWine, who he has said he does not like. Maybe that's what it's about. I don't know. I can't really tell. All I can tell you is this is not the way the country should be run. It should not be, look, you run an election, you fight over issues, you know, between the two parties, and then someone wins and has to run the state or the country, and you're there in charge of the benefit of all of the people of your state or your country, not just the people who voted for you and not against the people who didn't vote for you. So I would just, you know, reiterate, I am concerned there's politics involved, but it is hard to pinpoint. You know, I'm inclined to believe, because in so many other ways, this president seems like every decision is based on, you know, going after his enemies, protecting his friends, even, you know, corruptly taking money from people that he doesn't like and opposes. So I don't know the answer, I guess, to your question, and it's very hard to pinpoint, but we should receive FEMA dollars for the disasters that have occurred in the state of Illinois. Yeah, Dan, sorry.
Follow up on that really quickly.
Yes, of course.
The follow-up is,
Wait, I've raised more questions?
the follow-up is, do you plan to apply for FEMA disaster relief for the recent tornadoes, the one in Jefferson County you referenced, or have one of those determinations still be made? Because you had said you would seek it for KE.
Yeah.
But ended up not actually applying for the FEMA.
Well, remember, it has to do with counting up the damage that's done, right? And once you tally the damage in dollar terms, it has to meet a threshold that has been set by FEMA. By the way, it's been raised by this president. And so it's harder to get to that point. I mean, the example I would give is a small town that gets hit, you know, might be devastated, but the millions of dollars of damage doesn't hit the threshold of the federal government's number. And then there is no money that comes. You can't, you know, applying for it doesn't help if there's no way that damage estimate will get anywhere near the number. So that's the point. Listen, I want every dollar that we can get for everybody that's been affected by these storms. I'm going to go after it as best I can, but we have to live within the federal law in order to get it done.
And then back to the top of the day, just a couple, I guess, implementation kind of questions. First of all, do you anticipate any pushback from ABEC or any other medical record providers on implementing the sort of data segregation that's going to be required? And then for the standing order, you know, there's been a lot of talk about pharmacy deserts across the state, the shortages of pharmacists in places where there are pharmacies. So in practical purposes, how much is that going to actually increase access to those products?
Yeah. So I know those are two different questions, but related. Let's start with the medical records providers like Epic. They were at the table for this conversation, and you know, most of them understood the need for this, may not want to make the investment that's required to change their software but we're requiring it because it's the right thing to do. We're trying to protect the people who are seeking to effectuate their abortion rights, and Illinoisans who go to other states where abortion is not accepted and may even be criminalized. We want to make sure that our Illinois residents are protected, and so they have the ability to keep that information private from a doctor, let's say in Texas or in Florida. So as far as pharmacies are concerned, as you know, I've been very proud to be an advocate for independent pharmacies, and we've helped a great deal with the PBM bill that we got passed to expand the ability of independent pharmacies, first, to stay in business, and second, to expand their footprint. And indeed, I just heard from one of those independent pharmacists that they're opening yet another location because we've changed the law. So it's true there are pharmacy deserts, and there are people who can't access pharmacies as easily as others. And we're doing what we can at the moment, and I'll continue to work, especially because these are small businesses and people who struggle. I mean, I want to say to everybody, whether it's a pharmacy or any other small business, every big business in Illinois was once upon a time a small business. We should be advocating for those small businesses to not only stay in business, but also to grow. And so I'm going to continue to do everything I can for those small pharmacies. And yes, indeed, we want to make it more available wherever we can for them to access these pharmacy-provided contraceptives and other reproductive health measures. Hi, Isabel.
Off topic. Today testified to a U.S. Senate committee that the Postal Service will not mail ballots if the state refuses to turn over their absentee voter lists over to the federal government. And does Illinois have a backup plan for that?
Well, we'll see them in court.
And any thoughts related to that?
This is over and over again, the attacks from this administration on our states. These are illegal attacks, and we're thank goodness we have a great attorney general in the state of Illinois. Thank goodness that we have leadership in the state of Illinois that believes that we need to be protecting people's voting rights, which is not something that the federal administration today is doing. So that's all I can say about it. We're going to fight like hell to protect your right to vote. Yes, sir.
I'm sure you were watching election results last night. Saw primaries in New
I saw the results this morning. I'll admit I didn't watch the results last night. It was a long day yesterday. Yeah.
Your party's clearly moving left in primaries. You saw the DSA candidates really excel in New York last night. You've seen kind of a trend in primaries this year. For any capitalist, billionaire, progressive populists who are probably running for president, any advice for them?
Is Tom Steyer running for president? Is it? I would say, I think you've mischaracterized what happened last night. I don't know if you watched South Carolina, for example. There was a runoff election in which an admiral who had been fired by Donald Trump was nominated by Democrats over somebody who I guess you would say was to the left of her. And indeed, going back even to Mamdani's election, that same night, you saw that governors in New Jersey and Virginia, who no one would say are Democratic Socialists, were nominated. What do they all have in common? Last night and that night when Mamdani and those two governors were nominated, what they have in common is, or elected, what they have in common is they were talking about the things that really matter to people on the ground. That is, are you making life more affordable? Are you lowering costs? Are you attacking the things that are now attacking you? Are you attacking back Donald Trump? Are you fighting against and promising to end wars that Donald Trump has started? And to be against wars that get started because you're basically over oil, which is what Donald Trump has done at least twice now. And so I think the read here is that we have a big tent. We have a party that can have Bernie Sanders and can have Zohran Mamdani and can have Senator Warner and can have Governor Pritzker, all in the same party. We don't have to agree on everything, but one thing we do share in common is a desire to make life more livable, more affordable for the people of this country. And I think that's why voters are coming out to vote for Democrats and for people who are making that case. So, yeah, I think, you know, New York had its outcomes, but so did, you saw in other states, different kinds of outcomes. They weren't ideological, as I think you're pointing to New York as.
Thanks, everybody.
Thank you.